take a look at a couple of diseases of the cardiovascular system. Again, it's not meant to be all-inclusive. That would certainly take a whole lot of time and many, many videos, but let's look at a couple of big disorders of the cardiovascular system. So first up, we have our myocardial infarction. And this is a term that we use as the proper medical term for a heart attack. So while most of us would say a heart attack, you're going to start using the term myocardial infarction. You can see here on the left-hand side that a part of this heart has got this nice little dark spot, and I guess it's not nice because that part of the heart is dying from lack of blood. And so you can see the blood vessels here on the right-hand side. And so what happens with a heart attack is that fat starts to build up and creates damage to our artery walls. And we need our arteries to deliver our red blood cells to our muscles and to drop off oxygen so that we can live. And so when we sort of block off those arteries like we did on this left artery picture, what's going to happen is the blood can't flow through. What they're showing here is a stent. This is a little tool that gets fed into that artery. It pops open and helps to keep that artery portion open. But the best thing to do here is just to avoid too much fat in the diet. And it's not the absolute worst. There's a number of things that causes heart attacks, but it's that fat buildup around those arteries that causes the oxygen to not be delivered to the heart and causes heart death. So one of the things you should look up is I did include an abbreviation on this word list for the myocardial infarction. Can you see what it is? Because it's a big abbreviation. All right, hopefully you know that the abbreviation for a heart attack is an MI, which stands for myocardial infarction. Okay, next up we have hypertension. And so the first thing we're going to do is to look at the word breakdown, because breaking down this particular med term is going to help us in terms of knowing what it is we're dealing with. So take a moment, break down this med term, and then we'll do it together. So we do have a prefix here, hyper, which means excessive, a lot, right, too much. Tenso is the root term, which refers to pressure. An ion or ion as the suffix refers to an action of. So hypertension is an action of excessive pressure. So when we talk about hypertension, what we're really talking about here is high blood pressure. So again, if we get high blood pressure, this is a problem for us because we can damage some arteries. Next, let's take a look at atherosclerosis. So while I have this lovely picture here, and we're going to come back and talk about this picture, atherosclerosis can be broken down into its word parts, and it's going to really tell us what's happening. So let's first break down the term. See if you can do it first, and then we'll do it together. Okay, so there is no prefix here. However, we do have two root terms, so athero and sclero. And athero refers to a fatty buildup or plaque, right, would be a buildup. And sclero is a hardening, so it actually starts to harden the arteries. Osis is the suffix, which means a condition of, pertaining to. So atherosclerosis is a condition that pertains to fat buildup, and it causes a hardening of the blood vessels as it starts to build up. So atherosclerosis, you can see on this bottom picture, we've got some fat buildup inside the artery. Not only does it narrow it down, which can lead to some of the MIs that we talked about, but it can also lead up to this hardening and this fat buildup. So it almost walls it off in this hardened state, which creates some additional damage. All right, anemias. So we're going to come back to this one that we're showing, which is sickle cell, but there are a whole lot of different types of anemia. So we're really just going to look at a couple of them, some of the bigger varieties. But let's break down the word anemia first before we move on to any particular type. So go ahead and break down the term anemia. We'll sit here and wait for you. Make sure you get it right. So there is a prefix here. The AN prefix is the same as the A prefix that we just saw, so it means without, no, not, having none. There is actually no root term in this word, and it has a new suffix for us, emia, which is a blood condition. So anemia breaks down to a blood condition of without. Now, if you had absolutely no blood, right, that would be terribly serious for you. You probably wouldn't survive it. What we're really referring to is extremely low levels of blood, so levels that are lower, okay, than are what we need to get oxygen and other nutrients circulated around our body. And it does come in a lot of different forms. This one happens to be sickle cell anemia, which is a very common genetic type of anemia. And instead of having that nice oval shape to the red blood cell, what's going to happen is it turns into what we call a sickle shape, or like a moon shape or a C shape. The problem with this is that that oval shape of that traditional red blood cell is meant to sneak through the smallest of blood vessels. So that oval shape allows it to kind of smush and pop back open and smush and pop back open. It carries oxygen effectively and gets it out to the tissues of our body, whereas sickle cells, so those ones that are more moon or C-shaped, don't carry oxygen. Plus, they kind of get stuck in your smaller blood vessels, which leads to what we call a sickle cell crisis, which is extremely painful, can cause some tissue death, and it's not great for these patients. This is genetic. So essentially what we're doing is we're creating blood cells, not 100% of them, but some of your blood cells are not being created in the proper shape.